really an honor to be here and to represent CommonSpirit mission and diversity, equity, inclusion, and belonging. So let me get started with a story. Part of my legal hat, I want to de-identify the patient that's involved here, and you may see that this is a pregnant young woman with her husband. And bear with me because there is a connection to the story and our cardiovascular symposium. So this young woman is on her second pregnancy, and she came in requiring emergency C-section. Post-procedure, she was recovering with her husband, and she began to be diaphoretic and a little confused. The nurses said, "Hey, it's okay." The husband was getting anxious. "Something's wrong here." And the nurses continued to say, "It's okay, everything's okay." But it wasn't okay. She started hemorrhaging internally, had internal bleed, was in hemorrhagic shock. And though, as an African-American woman, she was dark-toned and couldn't see the telltale signs of pallor or maybe even poor capillary refill, the husband really stood up and said, "There's something wrong. Get the doctor now, right now." And a physician assessed her, and she was rushed back into the OR and stabilized. Meanwhile, part two is during the course of treatment, she had an MI, and they had to transfer her to a higher level of care. Now, I say this story because a few things. One is what we see often is not recognizing some signs or not listening to patients' or families' requests, and there is safety issues underlying that story. So basically, if it was not for the husband stepping up and advocating, she may not have survived. Now let me add a little color to the story. The husband's a physician, an ER physician. He knew the tail signs of hemorrhagic shock, clinical signs. It wasn't anxiety. And the patient herself is a physician. So when you think about the risk in maternal health and the risk with diabetes and the risk with preeclampsia and all the kind of complications that arise in women's health, and add to other post-cardiac cardiomyopathy, all these other complications that are related to pregnancy, as well as the tail signs that we'll be talking about today in cardiovascular health in women. It behooves us to understand that we have to be committed to listening to our patients, address our unbiased culture that exists, because there is no question a higher level of mortality and morbidity in the community of color. So, from the CommonSpirit National standpoint, the mission is particularly to address those who are vulnerable while we advance in social justice. One of the 6 domains of health quality that CommonSpirit corporate has committed to, one of the 6 is equity, health equity, to address it. And improving the health of our communities, disparities came along the presence and absence of income, community connections, housing, quality education, food security determines the health of the community. Now, believe it or not, there's a potential $135 billion saving a year if we addressed health equity. If we eliminate this, and that's according to a national report from the Kellogg's Foundation on racial equity. So under those economic determinations found that if you're able to eliminate health equities in the community of color, you actually save $135 billion a year. And what does that mean? It means, let's use the example that I just gave you. Can you imagine if she just went on to have a regular labor, no complications, or there absolute no complications? Her length of stay would not be an issue. The cost of transferring her to a high level of care and all the post-recovery and her time and her husband's time away from work for her to recover, which, by the way, took several months. Imagine the cost savings if we had prevented that incident. 3.5 million lives are lost from premature death alone. It's been determined. So there's a lot of opportunity. So the National Report on Equity basically says that if you're able to address equity, you're able to actually decrease sick time, you're able to decrease premium costs, and you're increasing productivity because people are able to go to work just based on those fundamental principles. So CommonSpirit has, and I'm just going to focus on the left side, some basic priorities: addressing from within, transforming from within, building analytic engine, standardized, equitable whole person care, partner effectively for community impact, and advocate for meaningful policy for equity. Now, from a local standpoint, we've taken those pillars, transform from within, and apply those principles right here in Phoenix. For example, we're going to partner with HR and identify areas to which we can promote diversity and inclusion. For building analytics engine, we're going to create a robust health equity dashboard. That's our commitment, and that's what we're doing now. To standardize equitable whole person care, we're going to begin to pilot screening, universal screening for social needs, and for partner effectively for community impact. We're going to understand how we can navigate and connect to patients and community resources. And lastly, for advocate meaningful policy equity, we're going to partner with external affairs and make sure we can really drive change in the local market. Now, the board is intricately involved in this. The subcommittee of the board has mission to ensure the hospital develops and implements these programs that I just spoke of, proactively promote the elimination of health disparities, and achievement of health equity for all. We already have this subcommittee moving forward. And lastly, to participate in development of review of following reports: the China, the Community Health Needs Assessment, the Community Health Implementation Strategy, and lastly, the Community Benefit Report and Plan. So these are things that we've done locally from CommonSpirit, that's directed from CommonSpirit, and we'll continue to address it. Now, keep in mind, and when we look at data and demographics, registration generally, it doesn't collect accurate information when we're trying to look and analyze our demographics. That's something that we're beginning to address right now. We want accuracy. We need accuracy, otherwise it's literally garbage in, garbage out. So in order for us to have a platform to understand what the needs are from employees to complaints of patients, what proportion, how can we identify the needs of our population if we really don't understand the data is critical as we move forward. So this has been a priority for us. Thank you, everybody, and thank you for your time, and welcome.